On behalf of Yale New Haven Health and Yale New Haven Health Bridgeport Hospital, I'd like to welcome you all to our Zoom conference. I'm Dr. Greg Buller. I'm the chairman of the Department of Medicine and one of the associate chief medical officers of Bridgeport Hospital. Our goal tonight is to answer all of your questions concerning coming into our hospital to deliver your baby and assure you of our hospital's safety. I will let you know that I work at the hospital every day. I see patients every day. And because of our vast experience throughout this pandemic with dealing with patients who have COVID-19, we have a tremendous level of safety for our patients and our staff. I feel much safer at work, for instance, than I do going into my neighborhood supermarket, vastly safer. And we want to communicate all this to you. So at this time, what I'd like to do is introduce our moderator, Kelly Reddington, who's the nurse manager for labor and delivery and antenatal testing at Bridgeport Hospital, and go from there. Kelly?
Awesome. Thank you so much, Dr. Buller. I'd like to introduce our panelists that we have this evening. Dr. Jean Tornatore, she's our medical director of labor and delivery. Dr. Magna Diaz, she's our chair of the Department of Pediatrics. Myself, Teresa Davis, the nurse manager of Women's Care Center. Dr. Gina Dunstan-Boone, one of our perinatologists. Rachel Burtz, one of our labor and delivery nurses. Karen Putney, one of our Women's Care Center postpartum newborn nurses. And then we have Drs. Buller, Dr. Ferrigno, and Dr. Victor Morris on as well to join us to answer some questions. So at this time, I'd like to turn it over to Dr. Tornatore to start our slides and get everything going, and then we'll get back and circle back to some more questions.
Thank you, Kelly. I am very excited to have everybody here and have this opportunity to be able to talk to you all directly and to give you some information about what we have going on here at the hospital. I know that when most of you started this journey into your pregnancy, you certainly didn't plan on having to deliver during a pandemic. And so your vision and your ideas and your dreams about what that might have been like are completely different. And our goal is to be able to give you some of that information so that you can start planning to continue to have a wonderful birth experience for you and your family. I want to start by showing you some information that I know you guys have heard many times. The information that you keep hearing that we know is the most important that you can do to keep yourself safe and your family safe. We want to continue to encourage you to wear a mask and wash your hands, and those activities that everyone out in the community has done has made a tremendous difference. We can see that here in the hospital. We can see the changes in terms of our inpatient population as well as how it's impacting our patients and our staff. The next slide. Some of the things that you also might have noticed that have changed for you both during your pregnancy and during your prenatal care is many of the offices have instituted a lot of new techniques to keep you safe. So your doctor's offices have probably started doing some telehealth and video visits to be able to keep you home when you don't need to come into the doctor's office to be seen. We at the hospital have also been providing some of these services through our antenatal testing unit. We're being able to provide telephone services and video services for things that can be handled not in person. In addition, we're trying to limit the number of visits to limit the number of people in our waiting rooms, and that has made a big difference. You'll notice that some of the offices, most of the offices also have limitations on visitors. That helps to decrease your exposure to more people as well as your family's exposure to more people. And our education department as well, our childbirth and breastfeeding classes have e-classes that are available that you could take online, as well as some video information that's available to you through our website. So those information, phone number and the website are available to you as well. The next slide. We continue to use the highest quality information that we have available to us to make sure that our providers are both skilled and knowledgeable about what's going on so they can work together with you to focus on your own personal experience to make sure that your experience with us is meaningful and exciting and wonderful and all of the things that you need it to be for welcoming your new baby into the world. Next slide. Some of the things that we're doing on the inpatient side to keep you safe and to keep your family members safe is that we've implemented a number of screening techniques. We're screening our patients and our visitors, as well as our employees. We're making sure that everyone that comes into this space is safe and is here to be able to keep you safe. We have a testing program that's very extensive. We're very proud to say that we started doing universal testing on our OB patients at the forefront of this pandemic. Now we're testing all of our patients that come into the hospital so that we can most safely care for each patient based on what their needs are. We did a lot of work at the beginning of this to upgrade our rooms so that we know that our patients have the necessary equipment that they need to be able to keep them safe. In addition, we use advanced cleaning and disinfecting techniques. All of our staff has personal protective equipment that they need to take care of the patient safely. We continue to monitor that daily to make sure that everyone has supplies that they need. And we're very supported by our health system to make sure that we continue to have what we need, as well as continue to predict what we might need in the future, and we continue to have that available. Our visitation policy is one of the core safety features that we have here at the hospital to keep our patients safe. We'll talk a little bit more about our visitation policy throughout the presentation and through the questions at the end. Next slide. So as we talked about, the changes that we've had on labor and delivery is that we have no visitors in the hospital. Our labor and delivery unit is one of the areas where we actually have an exception, where our laboring moms can have one designated support person with them. Some of the other changes that we've had to make to keep our patients safe is that we continue to support a mom's ability to walk in the room while she's laboring, but we limit her exposure by not letting her walk up and down the hallways. We still have tubs and showers available for water therapy. One of the other things that we have needed to stop is our nitrous oxide therapy for early labor pain management because of the aerosolized nature of what happens with the nitrous oxide. Next slide. We encourage our patients to work really closely with their own OBs before they come into the hospital. We want to make sure that they're working as a team with their OB provider so that before they come in, their OB provider is contacting the hospital so that we're able to best care for you when you get here. We want to make sure before you come to the hospital, if you're having any symptoms of COVID or any other respiratory symptoms, so that we can keep you protected and safe when you get here. We want to make sure that we know that before you get here. All of our patients and all of our visitors and all of our staffs, just like anywhere else that you are expected to go out in public, is that we ask that you do wear a mask when you arrive to the hospital. If you don't have a mask, we'll provide one for you when you get here. If you have a mask that you are more comfortable in, that you bring from home, you can certainly continue to wear that when you're here. Our patients, when they are admitted, if they need to stay with us, will be tested for COVID at the time of admission. Next slide. What we've been very excited about learning is that all of the work that our patients out in the community and all of our neighbors and our community members are doing to keep themselves isolated and with social distancing has really made a difference in what we're seeing out in the community. So through our testing program, as of May 26th, these are our numbers for what we're seeing for our patients who come in and labor. So we're testing all of our moms, and about 6% of the moms who are asymptomatic are found to be positive, which is much lower than what we were seeing in our New York population that we saw earlier in this pandemic and really made us all very concerned. So that is all a testament to the work that the people in the community have done. You guys have done with your families in keeping yourself safe and distant. So it's one of the things that you can kind of rely on to say that it's important to continue to keep those tenets in mind, to continue to keep wearing your mask and keep yourself socially distant if you can. And in those situations where you can avoid it, it will make a difference when you come in for us in labor. Next slide. So the big concern that everyone has is what happens if they are positive. All of our staff are perfectly comfortable and specially trained and prepared to take care of COVID positive moms. I think one of the things that we're concerned about is that patients never think it's going to happen to them. So we want to make sure that you understand that our goal is to work with you to figure out the best way to have you and your families and your newborn baby be protected and safe when you come into the hospital and through your entire stay. So we want to make sure that we work together to develop a plan that works for you to protect everyone in the family. Next slide. So we have lots of options and lots of recommendations for what we know will help protect your baby and to protect you. When we have moms who do test positive, we monitor them more closely to make sure that they don't develop any complications or symptoms from COVID. And then we have guidelines that we go through with the mom and with the family members for what happens after the baby's born and what we can do to help keep everybody safe. And we can discuss that. Your OB doctors have that information. They can discuss it with you during your prenatal care. We can also provide more information about that for whoever is curious about it. Next slide. What we are proud of is that all of the things that we're doing are keeping our patients safe. We have a very good rate. Our rates of COVID are declining pretty dramatically, even over the past couple of weeks. We have not had any babies who have tested positive, so we are protecting our newborns as well, which makes us all feel very good that what we're doing is making a difference for the community. Next slide. And ultimately, I think what makes us the most excited is that even through all of this, through the most turbulent times when every day the information was new and different, we were still able to, we're still having a wonderful birth experience and able to bring their newborn into the world and really be able to still treasure that and keep it a special experience for them. And I think that is the end of our presentation. So if anyone has any questions, we have a lot of time for questions. We have a number that were submitted ahead of time that we'll get through, and then hopefully we'll be able to continue to talk about any of the new questions that are coming in.
Perfect. So I think we'll get started with some of those questions that have come in from earlier today, and I'll cue it up to whoever is best to answer that question. So first one, now that there are restrictions to limit the visits to the hospital, will it be possible to get a virtual tour of the hospital's labor room on real-time video? And I think Teresa Davis is going to help us with that answer.
Thanks, Kelly. Yes, actually, we have a slide deck of photos of every area that you'll need to see when you come in to have your baby. There's a facilitator that will walk through every area with you, from Stark parking to the main lobby or the emergency entrance, depending on where you come in. The labor and delivery registration desk, triage, we have a labor room. Then we have the Women's Care Center unit where you'll come after you have the baby, an actual video photograph of the postpartum room. So we want everyone to feel comfortable and know what to expect when they get here. And the link to that is on the hospital website. Thank you.
Perfect. Thanks, Teresa. So I think, Dr. Boone, this is a question for you. With having coronavirus, does it increase the chances of miscarriage or preterm labor?
Well, fortunately, it's not looking like coronavirus has an impact on the incidence of miscarriage. We're not seeing more women coming in with miscarriage, and that is supported in the literature too. There does not seem to be an increased risk. So we still have a ways to go with getting more information of women who have had the virus in the first trimester, but so far, it's not affecting the likelihood of having a miscarriage. Regarding early delivery, it turns out that for women who have pretty serious coronavirus infection, particularly with pneumonia, they may be at a slightly increased risk for early delivery. However, most of these women are admitted, and we watch them very carefully for any signs of labor.
Perfect. Thank you. That's a good question. I think this one's for Dr. T. Will there be any changes for prenatal and postnatal visits?
You're on mute, Jean.
One of the biggest changes that we see and a lot of the doctor's offices instituted early on was trying to transition certain number of the visits to either telephone or video visits. There's a lot of guidance from the American College of Obstetrics and Gynecologists and a lot of other larger organizations about how to do that safely. And so most places have a very structured set of visits that intersperse both regular in-person visits with video or telephone visits. So most of our OB patients, especially towards the end of their pregnancy, still need to have an in-person visit. But other than that, the rest of the prenatal care is really individualized to the person and what their needs are. We are absolutely able to see patients in person and in real time when they need to be seen, and we haven't stopped any of that real-time care that needs to happen. Oh, and postnatally, so the other thing is that after you visit, after you deliver and you're going home, the biggest thing is going to be having that conversation with your doctor in the hospital before you go home, because many of the things that happen during your delivery are going to determine what your follow-up visits need to be. And they will determine with you if you can be seen just with a virtual visit or if you need to come into the office to be seen.
Perfect. I think this one's for Dr. Boone. Do we have to take additional vitamins to increase the immunity before and after delivery?
Prenatal vitamins so far are deemed to be adequate. There's no consistent evidence that I know of to support that any supplemental vitamins, in addition to prenatal vitamins, will improve immunity.
Okay. I think this is a question for our postpartum nurse, Karen. What are additional things to add in the hospital bag?
Nothing really special or additional to bring to the hospital aside from the mask that you wear coming into the hospital. We are asking that moms and dads are leaving pillows at home. We will provide you with enough pillows and supplies for yourself and baby while you're with us.
Perfect. Thank you. Visitation, there were lots of questions about visitation, so we're kind of going to lump those together, and I think Dr. Tornatore is going to talk about that related to siblings, parents, grandparents, etc.
Yeah, our visitor policy is very specific and clear. It really is one person. We're the one area in the hospital, we're one of the areas in the hospital that has the exception, and it really is just one person. So even throughout the whole stay, it's really just that one person. So it's difficult, it's a difficult decision. I know a lot of people have had a plan in place where they had a number of people that they intended to be able to come or be able to visit. But our goal is to really help you have a safe delivery and to keep the newborn and your partner who's with you safe and decrease the exposure to a lot of visitors in another hospital.
Okay. This one's about testing. Since moms will be tested for COVID when admitted to the hospital, even if they're not symptomatic, I heard the nasal swab is very uncomfortable. Rachel, one of our L&D nurses, is going to talk to you about that.
Hi, thanks, Kelly. So we do test all admitted patients now. Either one of the nurses or doctors will do it. It is a bit uncomfortable, but it only lasts a few seconds, and it's really the best way to make sure you and your baby are safe. So we test everybody now that's admitted.
Yeah, and that's a nasopharyngeal swab. I'm sure people have seen it already. If a mother tests positive for COVID, can she refuse separation from the infant? What happens? I think Dr. Diaz, this is a perfect question for you.
Sure, I'm happy to answer that. I think whenever we have these situations, what our goal is to really give you the information to be able to help support whatever decision you make. Ultimately, this is your baby and your body, and so we're here to give you the information for you to be able to make smart choices. We do recommend, if you're COVID positive, to follow the recommendations that have come out from the American Academy of Pediatrics and the CDC. We follow those guidelines recommending separation. We have found, as Dr. Tornatore mentioned, that with this policy being in place, that we have had no newborns who have actually ended up contracting the disease. That being said, we want to have a discussion with you about your specific individual situation to see what are your risk factors and what's your risk tolerance. So we will explain to you what the different options are and what that means potentially for your baby to the best that we can help support you to make a decision.
Perfect. Do mothers or support persons need to wear masks during labor all the time? I think Dr. Torrentor was going to speak to this.
Yeah, we really encourage people to stick with the guidelines of wearing a mask whenever you're around other people and you can't be more than 6 feet away. And we encourage people to really do that even when they're in the hospital. Now, that being said, and I have children myself, going through labor is a very difficult process. And so we try to make sure that if there are times when we already know your status, since luckily we know your status, and the tests that we have are supportive of you being able to take some breaks from the mask when the people in the room with you have their full protective equipment on, we can certainly work through that. Our goal is to really try and help you through the process and decrease everyone's risk as much as we can. But we're not going to try to make you completely uncomfortable all the time. So it is, as Dr. Diaz says, just like with what we're doing with the newborn, it is really a discussion about how we can maximize the benefit of what we're doing most of the time.
Absolutely. And I think we spoke to this before, but do we need to bring a face mask? If you have one, you can bring it into the hospital with you, but we can certainly provide you with one and your partner when you get here. Do we treat any COVID patients on any part of the maternity ward? I think Dr. Torrentor and Teresa were going to talk about this.
Yeah, so we absolutely, our unit is the only unit where we take care of obstetric patients. So from the very beginning of this pandemic, we worked very quickly to make sure that our unit was capable of treating COVID positive patients while they were in labor. So we've made modifications to our rooms on labor and delivery, as well as to our labor and delivery specific operating rooms so that we can care for those patients safely and with the best care and techniques and strategies that are available and that are recommended by the CDC. And then I'll let Teresa speak about what happens when they get over to the postpartum side as well.
Thanks, Jane. Yes, on postpartum, we actually have 5 rooms that are negative pressure, and they're situated away from our regular OB postpartum rooms in a separate hallway. So everyone can be rest assured that we're safe and taking good care of them.
Perfect. Regarding visiting, what are the rules about staying in the room? How is contact being limited? And can my husband stay or my partner stay with me overnight? Is there a bed for him? And I think Karen was going to take that question.
Sure, I can. So the care partner can absolutely stay at all times. They just cannot swap out for another family member or friend at this time. Moms in postpartum are able to walk in our hallways with a mask on to stretch their legs a little bit and get them moving, and to limit staff contact and how many people are caring for each patient. The resource nurse for the day who is making the schedule looks carefully at who was on the night before, who will be on the next day, and whenever possible, the same nurse tries to care for you during your entire stay, both on days and nights.
That's great. I think this one's for Dr. Boone. Do we have to quarantine before our due date? If so, for how long?
There are no current recommendations to quarantine prior to delivery. Neither the CDC nor the American College of Obstetrics and Gynecology or the Society for Maternal Fetal Medicine recommend that. It's very important, though, just to continue with social distancing, wearing a mask, and hygiene, avoiding, if possible, being around infectious COVID people in order to reduce your risk.
Okay. And I think Dr. Buller or Dr. Ferrigno, this question is for you guys. What protocols are the doctors and nurses following to reduce transmission?
Well, so thanks, Kelly. It's really at top of mind for us to make sure that first our nurses and physicians, when they approach COVID positive patients, are dressed in the appropriate personal protective equipment, or PPE, I'm sure you've all heard about. Everyone who comes into the hospital has a screen and is asked that if, in other words, their temperature is taken, and if it's above normal, then they're not allowed into the hospital. If they have any symptoms at all that might suggest COVID, then they also are asked to stay home and not come into the hospital. We have an incredibly low number of our staff that have tested positive for COVID, despite caring for a huge number of COVID patients over the course of the last few months, which right now is really ebbed down to a very small number. So we take every precaution and have been incredibly successful in utilizing those precautions at keeping our staff and then, of course, our patients completely safe. We have identified no patients, not one, who have contracted COVID by being in our hospital. Hope that answers the question.
Did. Thank you. And then I think, Dr. Ferrigno, this one's for you. Is there a different entry and exit for patients, and what measures are taken to test the hospital staff?
So thanks for that, Kelly. You know, there are the entrances that we have are our front entrance and our emergency department entrance. We're purposely limiting the entry points of our hospital so that we can carefully screen patients coming in. So as Greg pointed out, you know, at the entry points, temperatures are taken, people are asked, how are you feeling? If people have symptoms, we don't let them in. We also make sure everybody has a mask, and our staff is masked as well. So you know, you may think that coming through the emergency department might be not a great place to come through. It is a strikingly safe place right now. And like Greg offered, like Dr. Buller offered, we just have not had many of our staff contract this ailment, which is, you know, really demonstrates that our systems are being applied and working. As far as testing, we are starting to test our staff. And that's been something that's going on for the last few weeks. And the results are really striking. There are an incredible few people who have tested positive. Out of about 150 people who have been tested at Bridgeport Hospital thus far, we have not had any asymptomatic positives. And at Yale New Haven Hospital, I think we've had 2 or 3 positives out of about 400 or 500 people that have been tested. So very small amount.
Okay. Just a couple of follow-up questions to ones from before. Can a visitor come and go on postpartum if they need to care for other children? And Karen, I don't know if you want to follow up on that one too.
Yes, as long as the support person doesn't change, they are able to leave and come back, but they will be screened when they come back into the hospital again.
Perfect. And so this question just came in as well. So as a guest, if I have a fever, I will not be allowed to come back in with my wife. Just as the doctors have said, we want everyone to be safe at all times. So if you are symptomatic at all and don't pass any of those screening tests, then we unfortunately can't let you in. But hopefully that doesn't happen. And then there's a question about antibody testing. If we have a positive antibody test, can we skip the COVID-19 swab?
I'll take that, Kelly.
Yeah.
You know, the antibody testing, we wish we understand more about or understood more about it. There is a want to say that if you are antibody positive, that you are, you know, immune from the ailment, that maybe you cannot give it to someone else. And that's just not true yet. So we don't have enough information on that. Eventually, our hope is that we have a blood test that tells us that we are immune. We have a blood test or some finger prick test or some swab that will tell us that we're no longer contagious, and another one that tells us every time that we have the ailment. But right now we don't have those. And unfortunately, the antibody test, the one thing that it can tell you is that you've been likely exposed to COVID, but beyond telling you that you've been exposed to COVID, it can't offer you more information than that.
Okay. Lots of questions about testing. If tested positive weeks prior to delivery, how is the patient treated upon arrival? Would they be treated as an old positive or current?
Yeah, because that one I deal with every day. So what we're doing, we're encouraging, if you know that you have a positive test, make sure that you are communicating that directly to your obstetrician and you're trying to get that actual test result to your obstetrician. one of the things that we want to make sure everybody understands is that there are very different tests that are out there, and we have different sets of requirements for different tests as to whether or not how we manage those. If you are somebody who was sick and was positive within our system and has recovered, you do not need to be retested again. You will be screened for your symptoms, but you will not need to go through a nasopharyngeal swab for viral testing again. It's important that we do have that information in your chart. So if you can make that available to us, that would be fantastic. But you will not be treated as positive either, because as long as you're asymptomatic, you're considered recovered.
Okay. Lots of questions about, are we testing partners?
We are not testing partners because we are not considered the partners that come in are not having procedures and are not undergoing treatment by us. So our goal is to keep them masked, and if they are not symptomatic and they don't need testing for another reason, they are not being tested.
Perfect. Dr. Fergno, did you have anything to add to that?
No, I think Jean,
Oh, okay.
Jean summed it all up perfectly.
Good. Okay. All right. What is the average time of the hospital stay? I think we're going to briefly talk about that, Dr. T.
Okay. So the coronavirus hasn't really changed the way that we approach the hospital stay for patients, although a secondary finding is that we find that patients are not really wanting to stay around as long as they maybe wanted to stay around before. So we have noticed a decrease in our length of stay. We're not sending patients home before they're medically ready to go home. So you don't need to fear that, that we're trying to get patients out any sooner. If you're here and you need to stay, you absolutely will stay as long as you are medically required to stay. For vaginal delivery, you can stay for the 2 days once you feel ready, but we have lots of women who are going home at that 24-hour point if they're feeling comfortable and they want to get back home. It's important that you work really closely with your own OB to make sure that you have follow-up set up, as well as your pediatrician, and I can let Dr. Diaz speak about some of the pediatric pieces of that discharge, but we work together with the pediatricians to make sure that mom and baby both have a discharge plan that works well together.
Perfect. And then I think this is for Dr. Diaz. If I've had COVID-19 and I'm nursing breastfeeding, can I pass immunity onto my baby?
Sure. So I think this is a question that we would all like to know the answer to. And in fact, there is actually a study that's going on looking at this exact question. So once we have that answer definitively, we can pass that on. But for now, there are certain things that we know. We know that breast milk has a lot of good immune function that will help to protect the baby in general. And so we do always, pre-COVID and post-COVID, encourage moms to breastfeed their babies. We also know that with lots of testing of breast milk, nobody has found actually the virus in the breast milk. So I think that's also a really positive thing. So I think it makes a lot of sense, regardless of if you've had COVID or not, to breastfeed your baby.
Okay. We'll continue with Dr. Diaz. We have a couple more questions for you. How are visitor policies different in our neonatal intensive care unit? And how does it work with the pediatrician visits and circumcisions?
Sure. So in terms of our NICU, of course, this is a very special place that we hope that that none of your babies have to go to. But when we need to go there, it's a really important place to have access to, and we have a phenomenal NICU here. The babies in the NICU are more fragile because they are sick or they're born prematurely, and so for that reason, we really make an effort to make sure we're protecting the babies. That being said, again, we know that parents are not just visitors to the hospital. They are part of the baby's life and part of the baby's support system. So we have, just as with maternity, made an exception to the rule for visitors, and we do allow visitors into the NICU. We do not allow visitors who are COVID positive to the NICU for obvious reasons. And but we will allow both parents to visit, but just one at a time. Sorry, I think the other question that you had was about the pediatricians, and maybe referring to Dr. Tornator's question from before, which is how do things work in terms of discharge for the baby? Again, the American Academy of Pediatrics does not recommend the baby going home at any different time, whether that's earlier or later than before because of COVID. So we will again discuss with you the risks and benefits for your individual baby to as to what time is appropriate. We do always ask that babies stay at least 24 hours because that helps us to do screening tests on the baby and to make sure that the baby has gone through the transition to coming out safely. And pretty much everything else remains pretty much the same. We do sometimes, we want to make sure that if we're doing any procedures on the baby, including a circumcision, if you are COVID positive, that we have tested the baby. So that's the only difference there is if you are COVID positive, we do test the baby to make sure at 24 hours that the baby does not have it. And we closely monitor to make sure that the baby does not develop any symptoms.
Thank you. The next question is about lactation support, and I think, Karen, you were going to speak to that. Is that still available?
Our lactation plans have not changed. We have 3 full-time internationally board certified lactation consultants on staff that are seeing every patient. For someone that does have COVID, they are still having access to our lactation consultant.
Perfect. And then I think this one's for Rachel. Can I still have a water birth or use a birthing ball in labor?
So we're actually not equipped to have a water birth, but you could absolutely still use the tub for some aqua therapy during your labor. We also have wireless monitors and birthing balls so you could use to make your experience more comfortable and so you could, move around and relax the way that you like to.
Perfect. Thanks, Rach. I think this one's about partners. Does my partner have to stay, and if they leave the hospital, are they able to return? I think we talked about that. And then I think we were going to talk about food and nutrition with Teresa about that.
Yep. If Dad wants to leave, Dad can leave, but when he returns, he will be screened at the entrance, have his temperature checked, and also, if he decides to stay and not leave, the staff will be checking his temperature every 12 hours just to make sure that he's not becoming symptomatic. So with that being said, if Dad would like to go and bring food from the outside in, he's welcome to do that, but just know that he will be screened upon arrival back to the hospital.
Perfect. This one's about our operating room for our cesarean deliveries. Will the partners be allowed in the operating room if a cesarean is necessary? And I think Dr. Tornator, you were going to talk about that.
Yes, and I actually want to clarify that the support person will be allowed even if the mom is COVID positive. So we've made arrangements that if the support person is staying for the delivery while the mom is COVID positive and she needs to have a cesarean section, the support person can go into the operating room with the mom for the time of the section, and then when the baby is delivered and leaves, that support person will then stay with the baby to provide support for the baby while mom finishes up her C-section. So we try to provide as much support to the mom as we can for the duration of her stay and her delivery.
Perfect. Just a couple of other follow-up questions. Are siblings allowed in the hospital? Unfortunately, right now, we're just allowing mom to have one partner with her and continued support. And that really relates to how safe we've kept our patients. And we're really, really proud of that. And we want to keep that going. So I think Karen and Rachel, after delivery, there's new technology and FaceTime. You can share your newborn with your siblings that way until you get home. And then this one is about the antenatal testing appointments. With a high-risk team, can visitors come to those appointments? And Dr. Boone, I think you can chat about that, but right now we're still having no visitors, correct?
That's correct. Just the patient is allowed into the antenatal testing unit, and they must wear a mask.
Perfect. This question relates to how does the hospital support parents using a surrogate? If a surrogate would like to have her husband with her in the hospital, what accommodations are there for the parents of the baby who would also like to be there? So these situations are very unique. We'd love for you to chat with your OB provider, and so we can collaborate and formulate a plan ahead of time to meet everybody's needs. So each situation is different. So we really would like to talk to you about that ahead of your birth. So we urge you to do that with your provider, and we're always available to help as well, Teresa, myself, and Dr. T. Pediatricians. What are pediatrician offices doing to make sure infants are safe for newborn vaccine visits? Dr. Diaz?
Yeah, happy to answer that. So I can tell you, having spoken to almost all of the community pediatricians, that they are actively working to make sure that these visits are safe. So several things that have happened. Number one, a lot of pediatricians' offices are segregating their well visits and their sick visits. So for example, some will see their well visits in the daytime and in the morning, and then the sick visits in the afternoon. Other offices have actually, if they have multiple offices, have designated particular office buildings to be their well spot and their sick spot. But everybody is making sure that they're using appropriate protection, as we're recommending for you as well, to have universal masking, so to wear a mask for every visit to be seen. And this is also true, of course, for the vaccine visits. We're limiting, as pediatricians, bringing in sick patients and doing more of those visits, just like with OB, via telemedicine, unless it's absolutely necessary.
Okay. Dr. Fergno, this test came in. How accurate do you feel about the rapid test?
Well, there are so many tests out there. So there's a number of different tests. We use a rapid test that uses the same methodology as the slower test. So, and it's a very unusual test. It's called Cepheid. It has similar performance to the test that takes about 6 hours that Yale does. And also another test that takes about 4 hours that we do here at Bridgeport. So there is a rapid test out there that does not have great performance. It's called ID Now. It's the test that CVS uses. That's why we actually feel very confident in our testing platform here at Bridgeport Hospital and here at Yale New Haven Health, to the point that if you are tested somewhere else and you are negative, we actually don't honor that. We actually conduct our own test here to make sure that it's up to our standards. So I hope that answers the question.
Perfect. There's another one about that too. Would a second resurgence change and tighten these protocols? And how much continued flattening would have to occur to lighten them?
Yeah, that's
hard.
I don't expect that we're going to change the work that we're doing. We have tremendous lessons that we learned. Dr. Buller, offered us, insight into that when he talked about, the things that we've done, the things we've learned, our low infection rate of our staff, no nosocomial spread that we're aware of. I think when you have a track record like we have had, it doesn't make sense to take on calculated risk unless we have more information as we learn more.
Okay, sorry, my button was stuck. I think, Dr. Diaz, these questions are for you, some of them. We're planning on having a night nurse or family stay with us to help with the baby. Can and should we still do that? And yeah.
Sure, that's a great question. I think, it's one of those things that, of course, again, this is a special time and something that under normal circumstances, we love to be able to share with other people. I think that the most important thing, of course, is to try to reduce the risk to the baby of getting the infection, because that's the person who in the household is going to be at the highest risk for getting sick. And so for that reason, we do recommend minimizing the number of outside people that are coming into the home. But the situations will depend on what's happening individually. So for example, if you already have your mom living in the house with you and they don't have any symptoms and they've been with you for a while, would I say, oh, now you should kick them out of the house? Of course not. So, But we as pediatricians are here, and even before you deliver your baby, to be able to help you navigate your individual situation. So please feel free to call your pediatrician and discuss your individual situation with them.
Okay. And this is another NICU question. Knowing one person can visit NICU at a time, can both mom and dad visit the NICU to care for twins and to be there for both babies?
Yes, so we actually say that it is one parent per patient. So if there are twins, yes, we do allow both parents to come.
Perfect. There was a quick question, are our rooms private? All of our rooms are private. All of our labor rooms, our cesarean section rooms, and all of our postpartum rooms are all private with their own private bathrooms. Very nice. So no sharing. Dr. Diaz, this lends a hand into what you were just talking about. If I am positive, how do I care for my baby when I get home?
Yeah, that's a great question. So what we try to do is, again, assess the situation with you directly. In an ideal world, we would love to have somebody who is healthy be able to do the direct care of the baby. And in terms of we kind of encourage you to do the same thing that we would say under normal, circumstances for somebody who's COVID positive, which is to keep your distance from the baby, or to wear a mask and obviously wash hands, which is something that we would encourage, good hand washing, even under normal circumstances, because we know babies are more likely to pick up infections. But again, this is something that we can discuss with you in terms of your individual situation, the amount of time that we and the American Academy of Pediatrics recommends a separation from the baby in terms of direct care really depends on your symptoms and when you were diagnosed. So we can look at that individually for you.
Perfect. Dr. Charter, I think this question's for you. Will I be seen in person for a postpartum checkup?
So that really depends on your own OB provider and how you're doing at the time of your discharge from the hospital. We certainly, at least in our offices, have the ability to see our patients at their visit. Some of our patients who need to be seen even before their postpartum visit might have a video visit in between if they can have that set up. So again, it depends on how your delivery goes, if you have any complications during your stay, if you have any needs around blood pressure monitoring or other infection monitoring. But we are very flexible, and I know all of the offices for all of the obstetricians that are working here in our department are very flexible and are able to provide whatever is the most appropriate visit for you at the time that you need to be seen.
Perfect. Do the same nurses that work with COVID positive patients work with COVID negative patients? And I think, Teresa, we had talked about this a little bit before.
Yeah, so we do our absolute best to try to make sure that staff are assigned to care for just a COVID positive patient. In the event that that's not possible, we have ample PPE, personal protective equipment, which is, I know, something that was a concern early on in the pandemic, but we are actually in great shape and in the green for all of our PPE, which would prevent any contamination from one patient to another. But so far, we've been very fortunate, and for the most part, we've been able to have our nursing staff just caring for COVID positive patients or COVID negative.
Perfect. Thank you. And there's a lot of questions coming in. We are recording this, so all of the questions that we've already answered will be there for you to re-watch anytime that you'd like. And any questions that come in afterwards, we can always resend out as well. Really, again, our goal is to provide you with an excellent experience here. We are incredibly proud of the team of nurses and physicians and doctors and everybody coming together during this crazy time. And we're here for you, and we want you to know that. So I think no more questions? No? I'd like to thank everybody for joining, and all of our panelists and all of our people that are helping in the background to help me with all these questions. Thank you guys so much, and we will go from there. Have a good night.
Have a good night. Bye.
Thanks a lot. Have a good night.